Bleeding wounds are not as common, but again, a lot of these sporting breeds or dogs that are out doing field trials or working dogs, lacerations are part of a fairly routine thing that we will see. The number one thing we want to see whenever we want to do whenever we have a wound is be able to clean it, to make sure there's no major large pieces of debris, etc. We can either clean with an antiseptic soap or water, but really water or saline solution that you may have in your first aid kit is really the best thing you can do. A term we learned in our surgery classes in veterinary school that I'll never forget is dilution is the solution to pollution. So the more you can dilute that out, the more you can flush that wound out and get all that debris out, you're going to be far better than anything else. You can use an antiseptic solution, but you definitely want to avoid alcohol and peroxide. In addition to stinging, they're really, really painful, and you won't probably be able to treat the wound again for a while. They're also what we call cytotoxic, or they kill the cells that are there. And so you don't want to damage what's trying to heal the wound or heal the laceration. If available, you can cover the wound. If it's a smaller laceration, you can do a very similar bandage to what we did on the foot. You can do that up any of the extremities. It's a little bit harder to do that on the trunk, but on the extremities you could do that as well. If it's a large laceration and you have something like a clean towel or something like that that's in your car that you carry, then you could also put that around the wound as well. Trying to cover the wound to prevent secondary contamination from the environment, especially if you're out in a working area and the laceration occurs, well, then you have to walk through the woods again to get back to the car or whatever. Well, they're going to get a lot of contamination of that wound in between the vehicle and where the injury occurred. So if you can cover that wound to help protect it, that's one of the best things you can do. Bite wounds are small wounds most often. We'll see little puncture wounds, and unfortunately, we kind of blow those off sometimes as being fairly minor. Oh, it's just a bite wound, we'll clean it up, it's very small. Good, we're safe, not a big deal. But unfortunately what happens is dogs' mouths are extremely bacterial contaminated. They are very, very filthy. And so what happens is whenever that tooth enters into the skin, they actually inoculate bacteria underneath the skin. And even more so with cats. That's why cat bite abscesses are so common, because the bite wound is so infected that it'll develop an abscess. So any time that you have a bite wound, that is a medical emergency that needs to be treated. And it's something that really shouldn't wait through the weekend. Once that bacteria gets in there, it starts to work. I mean, they secrete enzymes that'll break down tissue. That's how they start to form an abscess. So you really want to address those earlier than later. You don't want to get behind the 8-ball on those. The other thing is whenever typically a bite wound occurs, you have the puncture portion of the bite, but then what happens is the animal pulls away and actually pull up and create a pocket that sometimes needs to be addressed with something like a surgical drain or something placed. So it's important that you have those addressed, if nothing else, to get an antibiotic to start on while the wound is healing and to facilitate healing of that wound.